All right, well, welcome everybody. My name is Joanna Cohen. I'm director of the Institute for Global Tobacco Control, and I'm really excited to welcome you to this month's Innovations in Tobacco Control seminar series. We have a wonderful speaker who I'm going to introduce in a moment, but first I'd like to take a minute and acknowledge that it is Native American Heritage Month, and I would like to give sort of a land acknowledgement statement. So I'm going to go ahead. I humbly acknowledge that Johns Hopkins University is located on the traditional and contemporary homelands of Indigenous peoples. Our campus resides on unceded lands of the Piscataway and Susquehannock peoples. We recognize the enduring presence of more than 7,000 Indigenous peoples in Baltimore City, including the Piscataway, Lumbee, and Eastern Band of Cherokee community members. I take this moment to honor and recognize Indigenous people of our homelands. I also want to give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty and right to self-determination. So thank you. And so yeah, I am really pleased to introduce today's speaker, Dr. Lauren Czaplicki. Dr. Czaplicki is a faculty member in the Department of Health, Behavior, and Society at the Johns Hopkins Bloomberg School of Public Health, and she received her PhD from our School of Public Health. And then she went to work as a research investigator at the Truth Initiative in Washington, D.C. She was there for a couple of years, and then I'm so thrilled that she came back to Hopkins and is affiliated with the Institute for Global Tobacco Control. Her research investigates how corporate actions regarding product marketing, sales, and regulation influence health behaviors, and to what extent various policy interventions counteract this influence. She approaches her work from multidisciplinary perspectives and brings both qualitative and quantitative methods to her research to investigate tobacco industry marketing in high, middle, and low-income countries. And she also leads studies to evaluate the beneficial impacts and unintended consequences of policy implementation, particularly on communities who have experienced marginalization. So today I'm really excited to hear her presentation on standardized packaging of smokeless tobacco. This is a really innovative area, and anyway, I'm going to join you in just like holding my breath and hearing what she found. So Lauren, over to you. Thanks so much for doing this.
My pleasure. Thanks so much for that introduction, Joanna. And welcome everyone. I'm going to go ahead and share my screen now. And can I get a thumbs up that we're still seeing all right, we did it right. So again, thanks so much for having me at this Innovations Lecture Series. It's really an honor to be with you all and to present findings from our recent study on standardizing the shape of smokeless tobacco products in Bangladesh. I want to acknowledge the many partners that informed this research, including the Bangladesh Center for Communication Programs, the National Tobacco Control Cell of Bangladesh, the Tobacco Control Research Cell, which is based at Dhaka International University, and the International Union Against Tuberculosis and Lung Disease. And I also want to especially thank my co-investigators from BCCP, Rashad Uzman and Tamim Islam, who you can see in the foreground of the photo, and our project manager, Sejal Saraf from the Institute for Global Tobacco Control, who is in the Zoom box at the top. It's my privilege to share the findings from our study on their behalf today. So here's a quick outline of the talk. I'll start with some brief background and the motivation for this study, then go over our data collection approach and key findings. And I'll close with thoughts on the main takeaways from this research and next steps. So many of you are likely already familiar with the evidence documenting how tobacco product packaging can influence consumer perceptions. Product packs can often contain colors, imagery, and brand-related claims, which could appeal to novice and current users. And packaging size and shape can also influence consumer attraction to tobacco products and potentially reduce harm perceptions of use. Importantly, these packaging elements alone or in combination all play a role in tobacco product initiation and sustained use. One way to counter the influence of branding while also informing product harm perceptions is requiring health warning labels be placed on product packs. Warnings are among the most direct means of communicating with consumers. And as you can see on the screen, larger warnings with pictures are significantly more effective than smaller text-only messages in reducing space for branding and conveying risk. To date, the majority of research on product branding and health warnings has focused on cigarettes and smoking. However, in the context of Bangladesh, rates of smokeless tobacco use are actually higher than rates of smoking. Approximately 21% of adults in Bangladesh use smokeless tobacco, and women are more likely than men to use these products. And you can see from the figure on the right that around 2/3 of current SLT users are women. And unlike cigarettes, there's also a diverse range of SLT products available in the Bangladeshi market, with Dorda and Gul being the most popular forms of SLT. And you can see from the image that SLT products come in a wide variety of packaging, which varies by the material of the pack. For example, whether it's plastic, cardboard, or tin, the shape of the pack, and the size. SLT is also quite affordable in Bangladesh, and most products are sold for well under $1 US. One artifact of this wide variety of SLT pack shapes and sizes is that compliance with the required application of graphic health warning labels is low. And by law, Bangladesh requires all SLT sold in the country include one of 2 pictorial warnings, which you can see on the left side of the screen. And these warnings should cover the top half of the front and back of the pack. However, adherence with placement of warnings has been poor. And a recent assessment found that 95% of Zorda packs and 42% of Gul packs did not have warnings printed on both sides of the pack. And around half did not have warnings printed on at least 50% of the top printable area of the pack. So this brings us to the topic of the research today. Standardizing the size and shape of SLT packs has the potential to increase compliance with warning label placement and reduce the amount and range of marketing on these products. And in recent years, this has become a priority area on the tobacco control agenda in Bangladesh. A set of standards for both Zorda and Gul, again, these are the 2 most commonly used SLT products in the country, were developed by the Tobacco Control Research Cell in collaboration with the National Tobacco Control Cell and Ministry of Health and Family Welfare. These standards stipulate the height and circumference of the pack, the tin material from which it should be constructed, and where branding is allowed on the pack. And you can see that the brand name should be placed at the bottom half of the pack, while warnings need to be placed at the top. Manufacturers would also be required to add details such as a product ingredients list on the sides of the pack not occupied by the warning images. And overall, there is limited research on how existing SLT products and shape of SLT products influence consumer perceptions. And most of this research is actually focused on the US or Scandinavian context. And research on perceptions of a standardized SLT pack is understandably scarce. The aim of our study was to explore how both non-users and current SLT users describe existing versus standard SLT packs in terms of attractiveness or appeal of the pack, noticeability of the health warning label on the pack, and perceived harm of product use. And here's how we did that. So this was a qualitative study. We conducted 28 focus groups in February and March of 2021, and all participants were recruited from low-income urban or rural areas in 3 regions of Bangladesh: Dhaka, Sylhet, and Khulna. And I should note that we wanted to include only low-income residents and rural residents to reflect the disparities of use of SLT across Bangladesh, where rates of use are higher among low-income individuals and those living in rural areas. 14 groups were conducted with non-users, and we define these as never users of any tobacco products. So they were essentially nicotine naive. These participants were between the ages of 18 to 35 to capture those most susceptible to use based on average age of SLT initiation. An equal number of groups were conducted with men and women. 14 groups were also conducted among current SLT users, and current users had to have either used Zorda or Goal or both in the past 30 days. There was no upper age limit for these groups, and they were equally distributed by gender. I also want to note that we conducted twice as many focus groups in urban Dhaka to reflect the size of the capital city and capture its demographic diversity. So each focus group was asked to discuss 7 existing SLT packs and 2 standard packs, and you can see these on the screen. For the existing packs, we selected and purchased the 3 to 4 most popular Zorda and Gold products across the 3 regions. These packs were labeled with a number, and participants were asked to refer to the pack by this number in the discussion. So you can see a number 22 written in marker on the leftmost Zorda pack. It's at the bottom there. And you can see on the rightmost Gull pack, number 7 is written on a sticker with marker and placed on the top of the pack. Our 2 standard packs were actually manufactured in Bangladesh. So we manufactured around 1,000 of these packs to the exact specifications recommended by the Tobacco Control Research Cell. And we worked with a graphic designer to design the pack branding so that it would feel realistic and approximate what participants might see on the market. However, the brand itself was fake and not available for sale. The standard packs were also priced at the recommendation of our partners, and this cost was actually higher than the average price for existing products on the market. So you can see that we priced the Zorda at 110 taka for 50 grams, whereas the average price for Zorda across a range of product size and grams was around 70 taka. In addition, we priced Gull at 15 taka for 20 grams. However, that was just slightly higher than the average price of Gull on the existing market at 8 taka. So now into the procedures of the focus group. So groups first reviewed the existing SLT packs, and they were asked to individually rate these packs on a scale of 1 to 5 in terms of how attractive the pack was to them. And the moderator then asked the participants to rate the packs together as a group and discuss their ratings in terms of why some packs were rated as more attractive by the group and some packs were rated as less attractive by the group. Next, groups were asked to rate the existing packs in terms of how noticeable the warning labels on the pack were. Again, each participant did this rating activity alone and then together as a group facilitated by the moderator. Following the group rating, the moderator led the group in a discussion of why warnings on some packs were rated as more noticeable than others by the group. Groups repeated this exercise one more time, and this time they were instructed to rate the existing packs in terms of perceived product harm. So following the individual and group rating tasks, the moderator then asked the group to discuss why some packs were rated as more or less harmful than others. And once the discussion of the existing packs was completed, the groups were then asked to remove those existing packs from the table, put them aside, and then replace them with their packet of the 2 standard packs, so one for Zorda and one for Gold. The groups then rated these packs on the same scale previously mentioned. However, this time the moderator asked the group to discuss how the standard packs compared to the existing packs in terms of attractiveness, noticeability of the warning, and perceived harmfulness. So they were comparing the standard Zorda to the existing Zorda pack, the standard Gull pack to the existing Gull pack. In the final part of the discussion, groups were asked to actually discuss whether they thought their own tobacco use in the case of SLT groups, or the tobacco use behavior of others in the case of the non-user groups would change if only the standard Zorda or Gull packs were available on the market. Data were analyzed to compare responses from non-user versus SLT user groups, and 3 data sources were used in our analyses. So these include descriptive statistics of participant demographics from post-focus group surveys, the average rating scores for the existing and standard packs on those 3 scales that I discussed, and a thematic analysis of the discussion across dimensions of pack attractiveness, warning noticeability, perceived harm, and behavior change in response to the standardized packs. All right, so here is what we found. Starting with participant demographics, 193 individuals participated across the 28 focus groups. And by age, most participants were between 21 to 35 years old. But due to our eligibility criteria, there were more 18 to 20-year-olds in the non-user groups, making this group skew slightly younger, and more adults 36 years or older in the SLT user group. By education, most SLT users reported a primary school education only, while a higher number of non-users had at least a high school degree. Finally, by occupation, a greater proportion of non-users were students, while a higher proportion of SLT users were employed as daily laborers or worked for the government. Briefly, I wanted to show that most current SLT users use Zorda on a daily basis, with substantially fewer daily or non-daily Gull users. Other SLT use was present, but it was low compared to Zorda and Gull. All right, so now into the results. I'll talk about our results related to existing SLT pack perceptions first, and I'll go through each content area one by one. We'll start with the perceived attractiveness of existing packs and the results from the pack ranking activity. So as a reminder, groups were asked to rate the existing packs that you can see in row 2 on a scale of 1 to 5, with 1 being the least attractive and 5 being the most attractive. We averaged the ratings for each pack across the non-user and SLT user groups separately. So overall, the non-user groups rated the existing SLT packs between a 3.1 and a 4.0 on the scale. So this indicates that they generally found the existing packs attractive. And Zorda pack 44 was the most attractive on average among the non-user groups. User groups rated Zorda packs similarly, with a slightly higher average score for Zorda pack 44. So this was clearly the most attractive pack across all groups. But across the SLT user groups, Gull packs were rated the lowest and considerably lower compared to the scores that non-user groups provided. The results from our thematic analysis can help us understand some of these rating choices. So broadly, across the non-user groups, appealing color was a primary reason for finding a pack attractive. As one non-user group member states, "I didn't like anything about the pack but the color." Other factors included quality descriptors. So for example, the taste or smell of the tobacco, and imagery of the owner. So in this example, the moderator asked why Gull Pack 5 is more attractive. The participant in the non-user group responds that they don't know the brand Mustafa by or the person Mustafa by, but the photograph looks good. It seems that he is a pious man and he would be a Muslim. Arabic is also written on the pack, hence it would make it less of a problem to consume it. Among the SLT user group, so now we have shifted to from non-users to SLT users, color was also an important feature for pack attractiveness, but it was often discussed in combination with other pack features, like the design of the pack shape. So for example, one group discussed how the color of the Zorda pack 55 was appealing, but other structural components like the bottom of the canister also contributed to appeal. And really what this suggests is that current user groups considered multiple pack features in their assessment of attractiveness, and color alone did not drive appeal perceptions, whereas color alone could drive appeal perceptions among non-user groups. Both non-user and SLT user groups also discussed that the highly visible or prominent warning label was a feature that made a pack, existing pack, less attractive. So as a participant in a non-user group state, the beauty of this container is not looking that much good. Injurious issues are written in most of the places. It doesn't look good to me. In fact, in many groups, the packs would have been more attractive if not for the health warning image. This next quote demonstrates how the interplay between the warning image and other attractive features were simultaneously considered in making assessments of product appeal. So participants in an SLT user group state that they like ZordaPack 44 because there's a photograph of the owner of the brand, or who they perceive to be the owner of the brand. And it also looks really ugly because there's this other picture of a lesion that you can see. Finally, both non-user and SLT user groups discussed that existing packs made of strong material, packs with a solid shape, and packs that were larger in size were more appealing. For example, one SLT user group discussed that they rated Gulpack 5 as less attractive because it was made of low quality plastic versus more durable tin. And a participant in a non-user group liked ZordaPack 44 because it had a sturdy plastic cover. Overall, these features made the pack seem strong and well crafted and aligned with the attractiveness ratings, where Gulpacks, which may appear less strong, were generally rated lower, especially by the SLT user group. So next, I'll discuss the noticeability of the warning on existing SLT packs. Again, we'll start with the rating scores, and this is a scale of 1 to 5, where 1 indicates that the warning is not noticeable at all, and 5 indicates that it's very noticeable. On average, the non-user groups rated the warnings on the ZordaPacks as more noticeable than the warnings on the Gulpacks, so they had higher scores for the ZordaPacks. The warning on Gulpack 5 was rated the least noticeable on average among non-user groups. Among the SLT user groups, the average ratings for ZordaPacks 22, 33, and 44 were relatively similar to the ratings provided by the non-user groups. However, SLT user groups on average rated the warnings on ZordaPack 55 and Gulpack 3 and 7 as less noticeable than non-users. However, both groups overall rated the warning on Gulpack 5 as the least noticeable. So turning to the discussion, we found that across both non-user and SLT user groups, participants discussed that the warnings printed in dark or dull colors were less visible. And in some cases, this actually seems intentional to the group. So as one participant in a non-user group stated, this picture on ZordaPack 22 is comparatively faded away. It is not getting to the eyes the way that it has been designed. The other side of this container is good, but it seems like they were trying to hide the warning side. Both non-user and user groups also discussed that clear, large warning images, particularly warnings placed on both sides of the pack, were the most noticeable. For example, a participant in an SLT group discussed how the pictures on the Zorda cans are big, so they're easy to understand, but the warning imagery on the Gull items are small, making them less easy to notice or to see. Additionally, a member of a non-user group described how the warning message on ZordaPack 33 occupied half of the area surrounding the whole can, enabling one to see the warning immediately wherever they look, which could translate to however the pack is displayed, potentially in a retail environment. Finally, just to close out this section, some non-user groups discussed how marketing on the pack competed with the warning for visual attention. So in this example, a participant in a non-user group stated that the marketing on Goal Pack 3 is noticed more than the small warnings. He further goes on to say, there are two non-warning related pictures on this container. They could have provided warning messages rather than giving two non-warning pictures here. And that if the warning were bigger and in less competition with the branded marketing, more people would be aware of the harms of this product. All right, so now I'm going to move on to our third scale and present results on perceived harmfulness of existing SLT packs. So this scale, perceived harmfulness, measured harm where 1 was the least harmful and 5 was the most harmful. And on average, non-user groups rated all Zorda packs between a 4 and a 5 on the harmfulness scale. And Goal packs 3 and 7 were rated a bit lower, around 3.5. However, you'll see here that Goal pack number 5 was rated the least harmful with an average score of 1.3. And if you remember back to the noticeability scale, this was the pack that was rated as having the least noticeable health warning label. In contrast, the SLT user groups rated the existing Zorda and Goal packs as less harmful overall. And this is particularly true for Zorda pack 55 and the Goal product, although the rating for the Goal pack 5 was similar across the non-user and SLT user groups. So turning again to the discussion, across the non-user groups, there were several marketing features that non-users felt made existing products less harmful. And so these included Arabic writing, and we heard a little bit about that earlier, a lack of a product expiration date, text about the quality of the tobacco. And one example of that is that the product is made from moisturized tobacco, and this seems less harmful to participants. And again, a photo of the brand's owner made the product seem less harmful. And in this quote, you can see how the combination of multiple features, along with a lack of the warning label, lowered harm perceptions of Goal pack 5. This participant states, no picture has been given there in this item. How will we understand how it creates harm to our body or if it is good for our body? However, they have given the owner's picture here, and the expiry date is also not mentioned. So in this combination, no harmful aspect is understood. Interestingly, some non-user and SLT user groups discussed how Goal might be seen as a less harmful product in general. So one non-user group discussed that Goal is potentially used to quit other tobacco products, and it's possibly lower on the harm continuum because of that. This participant states, in most cases, people consume Goal to quit smoking or chewing betel leaves, and this makes Goal seem less harmful overall. And my interpretation when they say chewing betel leaves is using the product Zorda, and that Goal could be a potential substitute that's seen as lower harm for people trying to quit their Zorda use. Most non-user and SLT user groups also discussed how these smaller, low-quality warnings on packs made them seem less harmful. And so in this example that I'm showing here, a group of non-users discussed how the warning on Goal pack 3 is blurry, it's unclear, it's printed upside down, and it's small. And they say if an old man buys this product, he won't notice the health warning as we barely can recognize itself. So this is really speaking to the lack of adherence to the warning label requirements and the limitations that this has on the warning doing its intended job. Just overall, many groups discussed that how the quality and size of the warnings varied across products. And this kind of seems intentional to them, in that they understood that less visible warnings may not stand out as much to consumers like themselves or consumers they know when those individuals are looking at all of the packs in a retail environment. All groups also discussed that the placement of the warning around the pack increased visibility and harm perception. So having no warning or only one warning or photo on the pack made the product seem relatively less harmful. And so in this example, a participant in a non-user group states that Zorda Pack 22 seems less harmful as it is just showing one photo of the health effects on one side of the can. Most groups also discussed how the warning text seemed less important than the warning image in conveying risk information. And so while non-user and user groups felt that the text played a supportive role, they did discuss that the text may not be useful if a person could not read or if the text was written in another language. So in this example, one participant argues for scoring Gold Pack 7 as less harmful because it is written in English that is injurious to health. And so even though people may not understand the English text, they can still understand the harms from the picture, but only having text or the text being written in another language is not useful. This participant ultimately says that having the text written in Bangla would have been good, but really the sentiment across this group and others was that the picture will always reliably convey the information regardless of language or literacy. And finally, some SLT user groups discussed that the current warning images may not work in terms of changing harm perception. And as this group of SLT users discussed, people, including themselves, have seen the warning. They know the risks and they keep consuming SLT. This could suggest some potential wear-out effects of the current images and could partially explain the overall lower perceived harm scores of Zorda and Gold Packs in the rating activity among current users. All right, so we've talked about existing packs. So now we're going to shift to the final portion of the focus group, which was the discussion of the standard SLT packs and perceptions of those packs. So similar to the existing packs, we asked participants to rate the standard packs in terms of perceived attractiveness, noticeability of the warning, and perceived harmfulness. And across the board, both the non-user and SLT user groups rated the standard packs very high in terms of attractiveness, noticeability of the warnings, and perceived harm. And most of these scores were very close to 5, if not 5. Both non-user and SLT user groups discussed that the standard packs were superior to the existing SLT packs on the market. As one participant in a non-user group shared about the standard Zorda pack, this one is bigger than the other items, and it is very durable. The products will be remaining good in this container. They also go on to say that the color and picture of the container are very charming. Overall, color, imagery, and durability of the pack were important in increasing the appeal of existing packs, as we previously discussed. So it follows that the standard packs seem to be substantially more appealing due to these factors as well. In addition, one SLT user group discussed that the higher price of the standard Zorda pack made it seem more attractive or to be of better quality. So this participant states, it seems very strong and the quality is good. It is highly priced at Taka 110 or roughly $1.25 US, which made it more appealing. All non-user groups discussed how the warning on the standard packs was more clearly understood and noticeable than the warnings on existing packs. And as one participant states, this picture on the existing packs is quite small. If anyone wants to buy it, they may not notice the picture. And the picture on the standard can is much bigger. The pictures showing the damage are on both sides. If anyone wants to buy it, they will notice it, meaning the warning. They will notice it easily. SLT user groups felt similarly. However, they were more critical of the warning image on the standard Gold Pack. For example, one group discussed that the Gold Pack warning image was not as clear or bright as the image on the standard Zorda pack. In addition, the content of the Zorda image seemed to resonate more with SLT user groups. And in this quote, the participant explains that the image of the child with respiratory issues was more impactful and made them think about how the product used could harm others and not just themselves. Nonetheless, all groups discussed that both of the standard pack warnings increased concern about use compared to the warnings on existing packs. And this was particularly true when comparing the existing Gull products to the standard Gull pack. As one SLT user group discussed, the picture on both sides of the standard Gull says that it is very dangerous. The picture will catch your eyes whichever way you turn this container. The containers available in the market are small. As a result, nothing is discernible. Everything is clearly visible on this standard pack. Turning to our last content area, behavior change, all non-user groups discussed how the warning on the standard packs would scare non-users. As this participant shares, new consumers will not buy this if they see the picture. But there was more mixed opinion on the potential behavior change among existing users. While most non-user groups agreed that the imagery on the pack would prevent new customers from buying the product, other groups discussed that consumers may have demand for these packs because they are hard and durable and might purchase and continue to use the product regardless of the more visible warning message. And you can see the quote supporting this below. SLT users felt that the combination of price increases with more visible warnings could reduce SLT consumption among current users like themselves. And as one group discussed, the price is high, and seeing the pictures, it seems that it will be harmful for the health. It is better to give up rather than consuming this, meaning the standard Zorda. However, this logic mainly seems to apply to Zorda, where there was a substantial increase in price from an average of 70 taka for existing packs to 110 taka for the standard pack. The standard Gull, on the other hand, was 15 taka versus an average of 8 taka, meaning that it remained relatively affordable. I do want to point out that there was some conflicting viewpoints on price among SLT users. There's some SLT user groups discussed that raising the price might also result in increased appeal. And as this participant explains, if it is costly, people will think that it's good quality, even if it is harmful. I want to close with what I think are the key takeaways from this study and next steps. And I appreciate that it was a lot of information to share. So I'm going to distill it down into what we think that the key findings across the different content areas were. So first, our findings suggest that existing packs range in their level of attractiveness, with color, owner imagery, strong material, and a sturdy canister shape being the predominant attractive features. However, existing packs rated consistently lower for both SLT users and non-user groups in terms of warning noticeability, which aligns with our prior research showing low compliance with warning placement on Zorda and Gull. So these results really support that these warnings were not very noticeable on existing packs. Second, we found that the standard packs examined in this study increased the visibility and noticeability of the warnings. And importantly, the warning on the standard packs were applied as recommended on both sides of the pack at the top 50% of the principal area. So this suggests that a standard pack shape alone won't increase warning noticeability. Really, standardization needs to be aligned with proper measures to enhance compliance with warning label placement. And this could potentially happen at the point of manufacture. So the standard pack itself doesn't increase the noticeability. It's the combination of the following the requirements in the law. Third, we found that the prominence and visibility of the warnings on the standard pack substantially increased harm perceptions, and which could result in behavior change. And specifically, we found that standard packs with the proper application of the warning may reduce appeal among non-users, particularly those who have never tried SLT products before. However, there were design features of the standard pack that may increase product appeal for both current SLT users and non-users. And this includes the durable shape and material of the standard pack, the higher price of the Zorda pack, which could convey that the product is of higher quality, and the remaining ability to use color and imagery that is still noticeable and appealing. So this is an important finding as it demonstrates the potential for unintended consequences in implementing a standard SLT pack, an SLT pack standard that could potentially increase product appeal on balance. So really taking all of this together, our study findings suggest that complementary policies might be needed to decrease the appeal of the standard pack while maintaining the increased harm perception. These policies could potentially include imposing a higher minimum price on the pack that exceeds 15 taka for Gold or 110 taka for Zorda, and really makes the price out of range for most consumers without suggesting the product is higher quality. Other policies include increasing the size of the health warning, which would thereby decrease the room for branding. Further, more warning messages could be created and added to the rotation of SLT warnings in order to reduce the possibility of wear out. Finally, there could be restrictions on including attractive features on the pack, like the imagery of the brand's owner, which was consistently found appealing. And color could also be limited, whereby brands are only allowed to use one standard color, like drab olive, across all SLT packs. I do want to mention that this study does have several limitations that are important to keep in mind. First, we only recruited participants who could read and write Bangla, and only 3 regions of Bangladesh were represented in our study. So our results need to be interpreted with these restrictions kept in mind. In addition, we only examined perceptions of Zorda and Gold and did not ask or discuss any other SLT products. And we only tested one standard shape requirement for Zorda and Gold, respectively. Finally, transcripts of the focus group discussions were ultimately analyzed in English, so the nuance of some issues as they were discussed and transcribed in Bangla may not be fully reflected in the results presented. Nonetheless, these findings are useful in informing current and future recommendations on standard SLT pack specifications in Bangladesh. And they really highlight additional supportive policy measures that might be needed for standardization to be most impactful. And before I officially end, I do want to acknowledge a few hundred individuals. First, I want to acknowledge the time and intellectual contributions of our almost 200 study participants across Bangladesh. I also want to acknowledge the deep expertise and the dedication of our research team at BCCP who carried out the data collection activities. And acknowledge the work of my fellow coders at Johns Hopkins, Sejal Saraf and Laura Crowhart. I'm also grateful for the supportive leadership of the directors of both BCCP and IGTC, Mohammed Shahjahan and Joanna Cohn, and the support and leadership of my colleagues and co-investigators at BCCP, Shamim Islam and Rashad Usman. Finally, I want to acknowledge the technical support on standard pack design from Ashish Pandey and Tahin Alam at the Union and Bloomberg Philanthropies who funded this research. And thank you to everyone for your time listening to this presentation. Here's my contact information, and I'm happy to take any questions.
Wow, fantastic, Lauren. Thank you so much. And I do, well, there's so much data presented. I can't imagine going through all of that, but terrific to hear. And it's so fascinating about the that the manufacturing and quality of the standard packs was attractive and a selling point. And I know just getting those packs, those packs manufactured was a big, we worked really hard at that. Well, particularly our collaborators at BCCP. So, and I do want to acknowledge our collaborators and friends from BCCP who've actually joined live this talk at such a late hour. So thank you for being here. Do you want to say anything about the challenges and the process of manufacturing these, and whether maybe we did do something that was like even better than normal, and how likely, even if a standard pack was required, would the quality of be as high as what was used in the study?
Yeah, so that's a great question. And I do want to also thank BCCP for being live at this presentation. That's terrific that you're here. So I have thought a bit about this, and one strength of this study, I think, is that we did use the materials and the manufacturers that are available in Bangladesh. And it's my understanding, and if Shamim or Rashad want to jump in here, that the company that we did use to manufacture these products actually already makes smokeless tobacco. Just by virtue of the restrictions that most manufacturers were in this business to begin with. So it would be unlikely for us to find someone that didn't produce these products. So I think that, yes, sure, if there was a range, if there was the standard as we set forth in this study, there might be a range in maybe some of the quality of the tin, or how the pack itself closes. But that really, like, sort of the sturdiness of the tin, which is what the standard requires, and the canister shape and the size are really kind of in combination create sort of this superior product, especially for gall, where you kind of shift from having this more plastic conical shape to a canister shape. And so again, another strength beyond using the sort of manufacturing that's available and the materials available in testing our standards is that these standards were also created with kind of thinking of what the tobacco industry is already doing. So there already are creating canister shapes, particularly for Zorda. And so the barrier to shifting to this sort of production would be lower, and maybe less. There would be less pushback, or no pending lawsuits, because it was something that they were already able to do. But I think the strength of, or not the strength, I think the sort of the importance of our study is that we were able to design something that approximated what might be available on the market, and really kind of identify some of those pieces that that maybe we didn't expect would increase appeal, and sort of think through, like, well, what might be the other policies that we need to scaffold onto this that could address some of that unintended impact. Yeah, but I think that was one of the most surprising findings for me as well.
Yeah, super, thanks. So we have a number of questions. Let me start with Tim Dewhurst's question. So he's thanking you for your insightful presentation, and he has two questions. So first, when presenting the pricing, he was wondering about additional context, how it converts to US currency. So I think you mentioned, you eventually did mention that, and then how the price compares to purchasing other sundries in Bangladesh. So that's number one. So anything of the relative price and the price of the two products. And then for existing packs and quantity, like how long, do you know how long a tin would typically last? So like, would people buy it daily, weekly, monthly? So any insights on that?
Yeah, so thanks so much for the questions, Tim. So the quantity is a great question. And I do know that, this product, if it's used daily, is used multiple times a day. So that I would imagine, and I don't have the exact answer for this, but for a 50-gram tin, which I actually have right here, so this is about the size of it, that would probably, be a weekly purchase, maybe a little less than a week. And I think that, the discussion of the durability and sort of the preservation of the tobacco in a canister shape that has a good seal speaks to that. This is a product that people don't purchase every day, but probably purchase weekly, I would imagine. And there are larger sizes available. So I think, as you scale up, the less number of times that you would potentially have to purchase in a month period. In terms of the price, so the price of the standard Zorda pack, so this is the Zorda pack, was 110 taka, which is roughly $1.25 US. And the price of the gold pack was 15 taka, which is about 5 cents US. I actually am not an expert on sort of the different market value of goods in Bangladesh, but having lived there, I do know that, this is generally very affordable and sort of on par with basic needs. Like I remember purchasing toilet paper for less than the cost of Zorda. So I think that it is kind of in that price range competitive with other, daily necessities that people purchase.
Super. And I just want to acknowledge a comment from Aminul Islam Sujan, who says that they've been having several discussions about standard packaging in Bangladesh over the past few years. And the Tobacco Control and Research Cell at the Dhaka International University, which is a grantee of the union, anyway, as per these recommendations, the standard packaging definition is included in the draft of the new law, and they are saying that they think that this study will support the ongoing process. So just a big thank you for everyone involved in the study. So thank you for that comment. And yeah, we'll make sure to get findings to the right folks to use in to strengthening, ensuring the law is as strong and without any loopholes as possible. So then just moving on to a question about pictures. This is from Ryan Kennedy. And so, it was clear how participants really felt that the pictures of the owners added to quality of the product. So Ryan was asking, and I think it's a really interesting question on a number of levels. Do you think we should use pictures of public health leaders in our health warning labels?
That's really interesting. I have never actually thought of that. I think that is actually, apologize for the street noise. I think that's actually something that could be potentially interesting to test in an experiment. I think we need to unpack a little bit why these portraits are so appealing. And I mean, that wasn't the main intention of this study. And so unfortunately, we didn't have the time to go into that with participants. But there is something authoritative or, just speaking to like that this product comes from a place and it's a good place, that those brands, those images of brand owners who we can't confirm they are actually the owner, just sort of like lends this sort of authority to the purchase. And I do think that is actually interesting to see how that would work with a graphic warning label, and whether it would compete with the other imagery or whether it would support it and maybe bolster it. Dr. Kennedy always has super creative ideas, and I would definitely be willing to explore that a little bit more, and also just hear others' feedback on these owner portraits, and kind of what your thoughts are on what they're doing in terms of increasing appeal.
Yeah, it's fascinating because, we've been collecting tobacco packs in multiple countries over the years. And it was so stark to see these faces on packs like in Bangladesh, also in India. And we don't see that in other countries where we've purchased packs. So it's fascinating. So for anyone who has some insight into that, particularly our colleagues from Bangladesh, maybe you can put that in the Q&A box, because it really is quite interesting and unique. So a question from Rajiv Trukapelli, and he's just trying to understand Zorda and Gul, and are they used by themselves like pan masala, or are they incorporated into beta leaf preparations? And I guess, and the follow-up question, if they are incorporated into these preparations, do you know if they're bought, if the Zorda and Gul are bought primarily by individual users, or by the pan leaf sellers who then put them together into a more complex preparation?
That's a great question, or series of questions, and it's my understanding that, not having ever used these products myself, that both the Zorda tobacco and the Gul tobacco are prepared with the beta leaf, and that's how they're typically used. And Zorda obviously is used at a much higher rate than Gul would be. My guess is that it's a combination of how these products are sold. I'm sure that there's some pre-prepared products that people could purchase, but there's also, a lot of imagery of just shelves of these products just being sold on their own. And from the focus group, the SLP users generally describe kind of their familiarity with the canisters of existing packs, and buying these ones, or seeing these ones used by elders in their community while they use another one. So I think it's a bit of both, but yeah, it would be interesting to kind of understand. I think market data is hard to come by, especially if there's informal economies selling these products. But yeah, I'm not sure kind of the distribution of how they're sold in the two formats.
Great. And I know we're almost at time, but I'll throw in one more question. And again, this goes back to the somewhat surprising finding about the attractiveness of the standard packs, particularly in terms of their assessment of quality. And so do you think, as Bangladesh is working on its revised law for the standard shape and materials, do you think maybe it should require slightly cheaper materials, or maybe not as durable, or I don't know if that's even possible, but question from Jeff Hardesty.
Yeah, I think that's actually super interesting. I guess the width of the tin could be further standardized, and I think as we move forward in the next couple of weeks, I'm sure we'll have more conversations with folks on the ground working with CCRC and the National Tobacco Control Research Cell, just to kind of talk through that. I'm not actually 100% sure what the width of the tin that we use, but I know that it was commonly available. So I think given that there is a range in that, is definitely worth sort of having an internal partner discussion. And unfortunately, we weren't able to test those differences, but it's a great thought.
Yeah, fantastic. Well, we are at time. First, thank you to everyone for joining, particularly again, our colleagues coming in from Bangladesh. And Lauren, Dr. Czaplicki, thank you so much for just a fantastic presentation on such an important topic. Really appreciate it. And I'm looking forward to seeing these findings incorporated into the revised law. So thanks so much. And thank you everyone for joining.
Yeah, thank you.